Okay, so we're going to go ahead and get started with today's topical call. Thank you all for joining. So today in our topical call, we're going to hear from Ronak and Matt from Adapt Community Network. They're going to be talking about innovation and technology related partnerships and how, and I apologize if you can hear my dogs, um, and how this has resulted in some new opportunities for their staff, their team, and the people that they support ultimately. So Matt is the Chief Program Officer. Hi, Matt. Welcome.
Hello, how's everybody doing?
And he'll be sharing a little bit more about himself today. And Ronak is the SVP, Senior Vice President of Community and Business Development. So I'm going to turn it over to you guys.
Thank you very much. So I'll briefly introduce myself, Ronak. I'll hand it over to Ronak, and then we'll kind of toss into the presentation. Matt Parascando, I've been with the DAC 19 years, started in 2006. I think that's 19 years. Currently Chief Program Officer. I started out as direct care at one of our day habilitation programs in Staten Island, one of the boroughs of New York City. Ronak?
Hi, everybody. Good afternoon. I'm Ronak Parikh, Senior Vice President of Community and Business Development, as Carrie mentioned. I've been at Adapt for a little over 2 years. Before that, I actually worked with Adapt it was one of my clients. I was at a healthcare consulting firm for about 14 years before I came over directly to the Adapt side. And yeah, we're excited to share a little bit about what we've been doing in the technology and innovation space. So without further ado, and feel free to chime in if you have questions. We do have, questions set for the last 10 minutes or so of the presentation. But if you have any questions while we're going through it, we're happy to, have this be an informal back and forth if you want. So I'm going to put the presentation on the screen, and I think Carrie has it. So, if anybody has any questions after the fact, or wants to reach out to us to learn more, you can either, I think our emails are on the invite, or you can reach out to Carrie and she can connect you to us. So without further ado, I'm going to put it up on the screen. Can everybody see that? All right. So Matt, turn it over to you to kick it off.
Sure. So just some of the things that are going to be a part of this presentation, I guess, is we're going to talk about how we've intertwined technology and innovation into sort of a strategic priority for Adapt. How we work with different partners, whether it be universities, and Ronak's going to delve into the specifics of that. One university was the University of Illinois on something called the Speech Accessibility Project, and how we were able to partner with them, not only as an organization, but the people that we support were able to be paid for being a part of a research project. And then what we're able then to do with that research and do with that opportunity. Working with companies, a lot of it was smaller startup tech companies, and one of us going to talk about Lotus Labs, which was a small startup tech company that had a really cool, innovative product that was simple and was able to completely improve and enhance people's lives and independence. And there was other companies as well. We're highlighting the Lotus Labs as one of them, but how we strategically tried to leverage these partnerships to benefit the people that we support, and how do we get technology, whether it be technology they've created and it's proprietary to them, into the hands of the people we support so they could use it and enhance their independence. And then we'll talk about some of the things that we have going on at Adapt. Smart Lab is a concept. It's a smart home, and again, we're not going to get the specifics of it, but it's a home, a freestanding home that's set up like a home that we are turning into we're calling a smart lab, but using smart technology throughout this home. No one lives there, and people from either live with the DAC or live in the community, you don't necessarily have to have an intellectual disability, to come in and test out some of this in-home technology and see how it could help them. What's cool about this concept is a couple of things. One, some of the partnerships that we've developed, either with Lotus, Station MD, and some other companies, they will have technology set up in this space. So if a person wants to test out a technology, say from Lotus, and test out the ring, we're able to help them with that. And connect them with Lotus on how they could purchase the ring, on how they could use the ring, get a demo of the ring, so on and so forth. The other really cool part about the lab, and this is a concept that we had talked about probably over the last 5 years. Space that we had, just trying to figure out what we could do with this space. It's an empty home. We used it as swing space for the longest time. If we ever had to have emergency work done in, say, a residence that we have, instead of relocating people to a hotel, we were able to use this space for that. During Hurricane Sandy, it came in handy, for lack of a better word, because we were able to relocate people there. We have some homes or a home on the water. We were able to relocate some people there during the hurricane and then after for the work. But we thought about how can we better utilize this space, and the idea of a smart lab came about. It coincides with this year ADAPT becoming a home enabling supports provider. And Ronak, again, I'll talk about that and how that ties into the lab. We also offer something called TechWorks, and we'll delve into that a little bit more. And we have that throughout New York City where people can come in and test high and low tech technology. And it's a lending library. They can also look at purchasing it, but we do lending for I think up to 60 days, and a lot of times a little bit longer than that throughout New York City. And then we'll talk about some key takeaways and different strategies. Next slide. Well, there we are again. I'm not going to introduce ourselves again. We bore everybody. This is just a quick slide on smart assistive technology and what it does. And we've done this in fits and starts, right? At ADAPT, we've done it and haven't done it well. We've done it and tried really, really hard, and have had some successes. But we often talk about how do we make it a real priority, and it's tough because the funding is difficult. It's very expensive. And in New York, you're restricted by a lot of regulations, especially around if we want to do something with remote monitoring. We'll talk a little bit more about that. But these are just some of the benefits that we've seen and talked about. How do we make this scalable throughout our organization, throughout other people in New York City? So the biggest thing, I like number 2, improves the quality of life for people who support. I mean, that's the obvious. We have a bunch of different success stories, whether it be with the Lotus ring that Ronak's going to talk about, or some other things that we've included where we've had people be able to live more independently using simple technology. Called simple. Funny enough, I'm not the greatest with certain tech, so I don't even have a Google Home or an Alexa in my house. I think it would drive me crazy. But we use that in one of our residences, and one of the benefits, it's a drawback and a benefit, but one of the benefits of New York City is one of our residences is in a multi-building, right? Bunch of different apartments, and ADAPT has apartments throughout this building. And we have a gentleman that lives by himself, but needs 24-hour 7 staff based on what his plan is, but he doesn't truly need that. Is there a way we could provide that level of support that he needs without having a staff in his apartment? And he does not like people in his apartment. He's very private. He likes to be independent, likes to have time by himself, but he still needs a level of care. And we use the Google Home, attach it to an apartment that was like 2 or 3 doors down from him, that was able to afford him the independence, improve his quality of life, and still was able to provide the supports that he needed staff-wise. So that's just a brief overview on what smart assistive technology is and how we've used it on ADAPT, for example. We go to the next slide, Ron. And these are just different opportunities. I think one of the things, I said this the last time, giving the people that we support an opportunity to do something that they've never done before, or use something that they've never used before, whether it be the Lotus ring, whether it be a Google Home, or using it in a way that they haven't used it before. Being a part of something and giving them a new experience is probably one of the, or is the coolest thing that I kind of take out of that. And also, obviously, increasing independence. The story I told about before. We had another person who we use remote monitoring through another organization, another partner that we partnered with, called Simply Home, and we had used their technology to have this person who lived by himself, but he was getting older, and that's obviously a big issue across the country is how do we help support people age in place, and we were able to through a grant, have smart technology installed in his apartment as well. And he was able to live by himself. I believe it was 7 years longer than he would have. Because at the knee jerk right away, especially here with regulations, the over regulations, you have to provide a staff right away. And this is someone, I think he was 77 at the time, had lived his entire adult life completely on his own. So you're talking almost 60 years completely on his own, now needing a different level of support. But we were able to use technology to bridge that gap and give him about 7 years where he didn't have a staff there as well. So obviously increasing independence was super important. And then obviously for the organization, especially when we're dealing with new partners, or we're talking about the Smart Lab, new revenue streams, which in these times I think is really important, as well as the thing that kind of gets me, the new innovative, cool stuff that we're not doing, and what could we do differently, and how can we improve people's lives differently and give people completely new experiences, whether that be through the different programs we do, through their just regular care, like the gentleman I just spoke about, different models of care, as the slide said, but it's just in their regular day-to-day, and new services for people who support, making it fun and exciting, but also providing them the support that they need. So those are the different opportunities that we've seen and that we've kind of experienced. And we're kind of get into the specifics now of both the Speech Accessibility Project and some of these other partnerships and how they've impacted ADAPT and the people that we support.
Thanks, Matt. So just wanted to preface, while we get into these specific initiatives that we've been engaging in related to technology and innovation, I could probably talk about each one of these for over an hour. So, I think today, just given the time, I'm just going to talk about each one of them at a high level. But again, if anybody is interested in learning more about what we did, how we did it, the outcomes, and more specifics on each of these initiatives, I'm happy to have a follow-up conversation. So just feel free to reach out. So with respect to working with universities, here at ADAPT, we've made a concerted effort to develop relationships and partner with both local and non-local universities and colleges to open up new opportunities for people we support, our staff, and the organization more broadly. These partnerships have taken many different forms, including internship and volunteer opportunities for students, college credits and certificate programs, including micro-credentials for ADAPT staff, projects with student teams at some of these schools to explore new program and service opportunities or tools, such as artificial intelligence solutions. You're probably hearing that all the time. We are too. And so we're trying to look at ways to, get, smart, interested students to come in and teach us about what they're doing and show us what we could take advantage of. And then the last one is, more traditional research studies that, researchers and universities are not always looking at us, IDD provider agencies, as a place that could really support innovative research. And, we're trying to change that dynamic, that paradigm. So we're going to talk about one of those partnerships through the example of the Speech Accessibility Project. And so as an overview, the Speech Accessibility Project is a research project conducted by the University of Illinois that has the goal of improving the voice recognition technology of everyday gadgets like your phone, smart speaker, your TV, so that it can better understand people with diverse speech patterns and disabilities, such as dysarthria. Especially a lot of the people that we support with CP have different levels of speech, and they can't currently take advantage of the speech recognition technology in all the various gadgets that we all use. It would aim to accomplish this by collecting voice samples from different groups of people with atypical speech, and that includes people with CP, ALS, and or people that have had a stroke, and using those voice samples to train voice recognition algorithms. And this project is kind of cool and unique in that it was funded by, it's a follow-up to Google's Project Euphonia, which we participated in about 6 years ago now. And it was funded by the 5 big technology firms: Amazon, Apple, Google, Meta, which includes, which is the parent corporation of Facebook, and Microsoft. So it's, the big entities. And the goal for them is to utilize and take advantage of these voice samples to enhance those voice recognition technology platforms that they utilize in all of their various gadgets and gizmos. So we were initially introduced to this project in late 2023. So it was a little while ago. And it was another CP affiliate, CP Unlimited, based in New York City, that let us know about this new opportunity. They had a connection to Google and got us connected to Project Euphonia. And then when this new opportunity came around, they connected us to the University of Illinois. And they were also a participant in this project as well. And so they probably have different experiences, probably maybe similar, maybe a little different from our experience in the project. Our main goal in participating in this project were to ensure that not only would ADAPT not lose too much money by supporting the project. I think if it was break even or even a small money loser, I think we would have been fine with it. But we also wanted to make sure that there were financial or monetary opportunities for the people that we support that participated in this project. And so the way we did participate was through a subcontract with the University of Illinois, which helped to tick both of those boxes. And we also were able to work with them to develop a number of unique protocols just for us as a subcontractor, which made it even better. And the outcomes, which I'll talk about in a few slides later, really show the value of us really being thoughtful about setting it up in a way that really made it a positive outcome, not just for ADAPT as the organization, but for the people that we support and our staff as well. Let's see. Move on to the next slide. So on the project structure side, I'm just going to say that this project wouldn't have gotten off the ground and wouldn't have been so successful if it wasn't for one of our program leadership, is the senior coordinator of operations, Kelly Spina, who led our implementation and operation of this project. She really stepped up to, when we identified the opportunity, she was very excited that yes, I'll take the reins and set it up, and then worked with her team to figure out a structure and a process to really make this project successful. And so she set up a very sophisticated, streamlined structure that incorporated speech and language pathology student interns that supported participants to capture the voice samples. She also employed a separate intern that coordinated the SLP student intern and their schedules. We had an assistant director that was supporting this project that helped coordinate with the rehabilitation directors to identify people when they were going to come in to the program, so that they can then schedule them with the SLP students to come in and to support them to capture their voice samples. He also tracked payments and the attestations for this research project. And then she herself, who provided oversight and coordinated with the University of Illinois. There was a lot of setup that was involved in getting this project off the ground, and that took a few months to get set up. And then once we did, we got rolling, and it was quite smooth after the initial hiccups of getting it all set up. Again, if anyone's interested in learning about some of the specifics and how we did oversight, management, and administration of this project, I'm happy to speak more about that and or connect you to Kelly, who can talk your ear off about it. But even though it took us a little while to get it all figured out, I think now we have a blueprint for working with universities and operationalizing research projects here at ADAPT. And although each new project will be unique and have its own idiosyncrasies, we still have a mechanism by which to work with universities or researchers to figure out how to make it work with the staffing we have, or if we have to, build in new staffing and try to structure it in a way that doesn't put too much burden on our existing staff and or our people supported. So in terms of the impacts of the project, the numbers really do speak for themselves. We identified and registered over 100 people supported that we thought could participate in this project. Of those 105, 93 of them completed the project and were paid $180 each for their time. So it was real, tangible, financial benefits for them. We actually successfully lobbied the University of Illinois to send checks to pay our participants, because the alternative would be for them to receive Amazon gift cards, which, many of our folks either, don't have an email address. Those can get lost in if they send it to a staff person or an admin person. And, they may not they may not want to buy something off Amazon. They might just want to buy something off from the corner store, or from, or just do whatever they want with the money. So that was a real big win for the people that we support. And they can use the money however they wanted to use it. The other 12 people, so 93 completed their participation. The other 12 people that registered but didn't complete their participation were either partially paid for their time. They probably completed a little bit, or they didn't end up being great candidates for a variety of reasons. Maybe they didn't have the patience to sit through a session to capture the voice samples. Maybe they didn't fully have a speech disorder that fit the criteria, and some other reasons. And the last piece was, we were able to identify speech and language pathology students and pay them for their time. We paid them close to $13,000 total to 6 SLP students, so over $2,000 per student to support the project. So we were able to get, students in. We didn't have to, use up existing staff's time to support this project, and they got paid for their time, so they got something to add to the resume, but also got to work on something cool and innovative. So some really great impacts on this project. So lastly, just wanted to quickly recap and highlight a few benefits of the project, some of which I've already talked about. So on the compensation side, obviously already mentioned that people that we support who qualified and participated, they were able to participate in a cool project and were competitively compensated for their time. On the opportunities for our staff, we were able to give our staff opportunities to be involved in a really cool research project and give opportunities for the people that they support. I already mentioned this, and the SLP students were able to work on a very cool, innovative project, and got hands-on experience working with people that we support, and got paid for their time at no cost to Adapt. This was paid for by the project. The university was able to benefit. They were able to collect data in a sample pool that was much larger than they were used to. I think we were the most successful partner that they had, subcontracted partner that they had. And I think the next closest was probably, I think, less than 50 people that they supported to participate. And we had close to 100 just at Adapt. And because the project was so successful, we actually applied for and got additional funding from the University of Illinois to extend the project to one of our affiliates, Adapt to the Hudson Valley. And so we're actually working on that now, and we're getting, I think, close to 50 new people in Adapt to the Hudson Valley to participate in this project as we speak. So that's an even larger benefit for people that both Adapt and Adapt to the Hudson Valley support. And then lastly, we were actually able to benefit from the success of this project, in that the University of Illinois separately reached out to us after the fact to jointly develop and submit a new NIH research grant proposal along with Columbia University to develop and test out a new speech therapy that, utilizing a self-assessed speech therapy that they're working on developing. I'm not too confident that we'll get it, just with the funding cuts on the federal side. But if we do, that project will start sometime in 2026. So that's another great opportunity. And then finally, this project has enabled Adapt to be recognized as an organization that is involved in impactful research for our population, and allows us to be an organization of choice for future opportunities. And again, we've kind of created a blueprint here, so it's going to be that much easier to get involved in projects like this in the future.
One of the cool things about the working with universities, specifically University of Illinois, too, was the universities and the companies that Ronak's going to talk about in a minute. They're really looking for partners, especially in the IDD space. And it's, I think we were always, I don't want to use the word shy, but maybe we thought not, or they don't need us, or they're not doing something like this. But just a simple ask is what opened that door to the speech accessibility project and the impact that it had, and it's continuing to have. is amazing, as well as the ability to have true research with people with dysarthric speech with intellectual disabilities. So all it took was a simple ask, and I'm sure we were told no a lot. But I'm used to being told no. So Ron, sorry, Ron.
Yeah, no, it's a great point. So moving on to working with companies. So this is another area that we have prioritized, and it's specifically prioritized partnering with technology companies that can directly benefit people that we support to be more independent, have a safer living environment, integrate into the community. All of those great things. There's all these other technologies, artificial intelligence, technologies that can make business operations more efficient. I think we want to put that aside for now and focus on some of the technologies that are out there that can really support people that we serve to be more independent. We've really been looking at ways to pilot and demonstrate technology and get technology into the hands of the people that we support. So not only just having it out there, but really giving it to the people so that they can use it in their day-to-day lives. And this includes many companies that you may have heard of in the past. Either, I'm actually at a conference right now in Philadelphia, an Open Minds conference, where a number of these companies are presenting about, their technology and how it can benefit people we support in the organizations. And they include companies like Riften that has a number of adaptive equipment like chairs, adaptive desks, adaptive tricycles, and other equipment. There's Simply Home remote supports platform and technologies that support people to live more independently in their own homes or even in residential programs, and Station MD, virtual urgent care solutions that are specifically tailored to people with intellectual and developmental disabilities. And so some of these organizations, actually, we're working with all of them, but the one that we're going to talk about most specifically and give you an example of is Lotus, which is a startup technology company that Matt mentioned. And I'll actually show it off during this presentation briefly so you guys can actually look at it. So the Lotus Ring. So we got connected to the founder of Lotus a little over a year ago when they were still in the development stage. So the founder of Lotus was a former Apple engineer, and he initially designed the device for himself since he has twisted knees. So he was born with twisted knees, made it difficult. He actually, used crutches up until, relatively recently. Now he can, walk without crutches, but he still uses them for a lot of walking around, especially when he walks around for a long time. And he developed them, specifically so that would be easier for him to turn on and off the light when he was in bed, so that he wouldn't have to fumble around in the dark. And he didn't want to necessarily have to set up a whole smart home system in his home, programming all the lights and having to, talk to a smart speaker. He just wants something that was simple and easy, that you could just press a button and turn it on and off and not have to worry about, setting up, an account, a login, connecting it to the internet, all of that stuff. He didn't want to do that. The interesting thing was when I first met him, he was thinking that the device would be really beneficial for seniors, veterans, people with physical disabilities, but he wasn't really thinking about people with intellectual and developmental disabilities that we support. So, in talking to him, we were able to convince him to at least think about our population as a target audience for his device. And so, he kind of went back, and then fast forward about 6 months later, and Lotus was able to get funding from the New York State Office of the Aging, which is one of our state agencies focused on seniors, to do a small pilot to test out their device with 50 people in New York State. The Lotus founder, he came back to us and asked if we would be interested in participating in this pilot, since they weren't able to get traction with enough providers and people that those providers supported in terms of the seniors, because the funding was from the Office of the Aging, so they wanted to target seniors for this pilot, but they weren't able to get enough interest. And so he reached out to us, and we jumped on the opportunity. I think it was great. Our program leadership, including Matt, who's on the phone, quickly reached out to our residential directors, who in turn asked the people that they support if they were interested in participating in this opportunity, in this pilot. And they quickly identified 12 people supported in probably, I think, 2 or 3 days. We did a quick presentation to a lot of our directors. They went back and asked their people supported. And in a couple of days, we got a list of 12 people that were like, yes, they'd be great candidates, and they were interested and they want to participate. And since we got back to them so quickly, they asked if additional people that we support would want to participate. And then we went back to them with 8 more people, to make it an even 20. So we had 20 people that were going to be participating in this pilot. And then lastly, similar to the speech accessibility project, we wanted to make sure that our people supported would receive a financial benefit in participating in this project. So we asked Lotus, we're like, can we get something out of this for the people we support, either money or maybe they can get one of these Lotus rings for themselves to keep after the pilot's done. And so what they said was, all right, let's see. And they came back to us and said, okay, yes, we can have every single person that participates get a free Lotus ring kit, which is worth $400. It includes the ring, which I'll show you, and three light switch covers that they can then use after the pilot's over in their own homes, and that's it. It's theirs to keep. And so that was a boon for us and a boon for the people that we support. So how does the Lotus ring work? So I'll just talk about it, and then I'll show you. So it's very simple. You put on the Lotus ring. You put the Lotus so that the button faces your thumb, so it's easier for you to click on the button. And it uses infrared technology, similar to what you have in your remote control from like 20, 30 years ago, maybe longer. And it connects to a light switch cover that's proprietary light switch cover that easily it has magnets on it and then easily connects to an existing light switch cover. So you literally just plop it on, it magnetically connects, and you point and click, and it'll turn on and off the light switch. So it's very simple. It connects with both toggle switches as well as rocker switches. And so some of the newer switches, it may or may not work with, the ones that have like the dimmers, and I think they're working on something that can work with dimmer switches and all that. But it works with all the traditional rocker and toggle switches. So I'm going to stop sharing my screen for a second so I can show you what it looks like in person. So here's the ring. So you can see it has the sensor right here. It has the button right there. And so I'm probably going to have to change my settings so it doesn't blur my background. There we go. So here is a light switch, and so this is the light switch cover. It's just a regular old rocker switch. This is a light switch cover. It magnetically connects. You can press it on and off with your finger, so it still works even though you don't have the ring. And then you can just point and click, and it turns on and off. I don't know if you can see if the light turns on and off, but that's literally as simple as it is. And the people that we support that used it thought it was brilliant. Very simple, very easy. It's not the most accessible from a price perspective. It's $400 for one of these kits. But the cool thing is that one of these rings can operate any of these light switch covers anywhere. So if you go to even a staff person, if they go to multiple homes, they can utilize it, one ring in multiple homes, and it'll still work. I'm going to reshare the presentation. So the really interesting thing about this is not only the people that we support. I think we had 20 people supported that participated. I think 19 of them found it, really great, really simple to use, really made my day much easier. I could, come home, turn on the light, in my wheelchair, go back and turn it on and turn it off before I go to bed, fumble in the dark, or wake up in the morning and fumble in the dark to go turn it on in the morning. I think they all found it to be rather great. I think there was one person that, I think they had neuropathy and didn't really like the ring touching their skin. And so they didn't really, take to it. But there were still some people that we supported that, didn't really like having the ring on all the time, or even some of the time. So some of our staff fashioned lanyards for them to have it around their neck so that they can, put it on and use it whenever they needed to, and then take it off and have it be around their neck so they don't lose it. And the great thing is that, this technology You charge it for about an hour, it's good for 4 months. And the light switch cover, you charge it for about an hour or two, and it's good for, I think, about a month. So it doesn't require too much charging because it doesn't use that much energy. So it really made to be very simple, very easy to use. And some of the other cool things is that with some of the feedback from the people supported and our staff, Lotus actually, they came back in person to do interviews with the people that we supported just to hear their feedback and to take that information to help inform their future strategy, to make any changes or to come up ideas for new products. And so one of the products that they're planning on coming out with in the near future is integrating this technology with automatic door openers. There's a company out there called Open Sesame that makes automatic door openers. So they've been working on partnering with them to integrate the tech so that they can be multiple modes of operating these automatic door openers and open doors. You can either press a button like a traditional thing, or it's connected to one of the smart home apps like Alexa or Google Home or Apple. Or a third input method could be just pointing and clicking using this Lotus Ring. And so, as this company matures, there could be, this ring could operate multiple things in the home. And actually, they're in the process of coming out with one additional item. It's essentially, for lack of a better term, it's just a extension cord that has one of these light switches on it. And so you can put a light switch cover on it, but whatever you connect the extension cord to, like a fan or a TV or anything else, you can control it using one of these rings. So, they're slowly starting to plan on coming out with new products. And so, it doesn't have to be super high tech. This is, I consider it kind of a low tech, high tech item. And it really has a lot of utility for the people that we support. So quick recap of some of the benefits of ADAPT participating in the Lotus pilot. So compensation, we already talked about the fact that people we supported got to participate in a cool pilot. They all talk about it whenever someone goes to visit or when they meet their friends. And they also get a $400 ring at the end and the kit at the end of the participation in this project. Again, our staff created new opportunities for people that they support and provided feedback to Lotus to inform their future strategy. Opportunities for us more broadly is that now Lotus has focused on the IDD population as one of their target markets, which wasn't the case previously, which is, now they're really going to be looking to make this available more broadly. In addition, because, they got so much great feedback from our people supported and our staff, Lotus paid to do video interviews of our people supported and staff that we can then use for joint promotional purposes. So we have a whole set of content that we now have that we can use in whatever way we want, which is another great benefit. We're recognized by Lotus and now other organizations as a reputation as a responsive partner that delivers on what we promise. And we're actually working with Lotus to add their technology to the Smart Lab that Matt was talking about before. And we're also going to be making it available to the new Home Enabling Support Service, which is a new Medicaid waiver service that'll be available in New York for people with IDD living at home or in the community, which I'll talk about a little bit more later. And lastly, just on the Lotus front, and this was only announced a couple of weeks ago, we wanted to mention that Lotus was selected to be included in Time Magazine's Best Innovations list for 2025. And they were also selected to be on Shark Tank this season. So they'll actually be on an episode. I'm not sure exactly when, but it's probably going to be in a month or two. But you'll be able to see them on TV. And so some of the people that we supported that were in the video interviews that Lotus did may actually end up being on Shark Tank, depending on how the producers cut the episode. So we're kind of excited. I think we're planning on doing a viewing party for when that comes out. So that's a quick overview about partnering with companies. And we're doing similar things with a few other companies as well, related to our Smart Lab and with Home Enabling Support. And then the last big area, just talking about working within ADAPT on some of these technology-related initiatives. So we've, I think Matt mentioned this, but we've been a leader in assistive technology and adaptive equipment, not only for the IDD population, but for the population more broadly for a long time through our TechWorks program. The program started in 1990, and I'll go over that in a little bit more detail. But I don't think, and I know Matt doesn't think that we're alone in thinking that technology, assistive technology, all of these partnerships, all of these opportunities is the future. I think the good thing is that our leadership at Adapt has agreed with us, and we've doubled and tripled down in focusing on getting technology into the hands of people we support by developing the smart lab on our campus in the Bronx, and by being one of the 8 providers in New York State in the upcoming home enabling support service. And again, this is still just the beginning. I think we are just scratching the surface here. There's a lot more that is to come that we can benefit from, and the people that we support can benefit from. So just quickly wanted to reiterate the definition of assistive and enabling technology. I know Matt mentioned it earlier. They represent devices, equipment, software, or solutions that help people with disabilities adapt to their environment and perform functions that may otherwise be difficult or impossible. And here's why we want to expand assistive and enabling technologies to the people that we support. There's no central resource for people with IDD and their caregivers to learn about and test out those technologies and solutions. These technologies are not always tailored to the specific needs of people with IDD. Technology vendors typically don't think about the IDD population as a market. They don't even know about us half the time, let alone think that we're big enough to warrant working with us and developing technology specifically for us. And universities don't always partner with IDD provider agencies for research and develop these new technologies, thinking about our population and our need and their needs in their minds when they're trying to develop and create all these new tech. So we think our multi-pronged strategy can really help change that paradigm. So wanted to give a quick overview of our programs related to assistive and enabling technologies. So there's TechWorks. So this is our original program. It's been around since 1990. It's funded by a state contract that is ultimately funded by the federal government through the Trade Act. It's a public resource for anybody in New York City that can benefit from assistive technology. We have 3 centers in New York City and a mobile van. We also have a lending library that can loan out devices for short periods of time for people to try out and test out their equipment in their own homes. We also have staff that are incredibly knowledgeable, that have been here for a long time about assistive and enabling technology, and are constantly keeping abreast of the latest and greatest out there that related to assistive and enabling technology. So we always have they're always looking at purchasing, making it available for people that we support, and people can come visit our centers and learn about it and try it out, and even take it home with them and try and borrow it for a period of time. So we're always out there. Then we have home enabling supports. So like I said, we're one of 8 providers in New York State selected by the New York State Office for People with Developmental Disabilities to offer access to assistive technology, remote monitoring technology, and health and communication services technology paid for by Medicaid to people living at home or in the community. And we're currently working with New York State care coordination organizations here in New York and technology vendors across the country to get this new program off the ground later this year, more likely early next year. Probably January is when it's going to launch in 2026. We think this program is going to be a game changer for our population, and it's going to open the door for technology to be more broadly and readily available to people that we support, including those that are living in certified residential programs. I think, Matt mentioned that, we already tested out some of the Simply Home remote supports technology in our residential programs probably about 6-7 years ago. I think we got a grant that helped support that. We didn't get sustainable funding, but I think we're now at a point where there's no question that the benefits of some of these technologies, we just have to show the right folks either at the state or other funders to show that there's value in really extending this to more people so that they can benefit from it. It'll not only benefit people becoming more integrated into their environment, into their communities, allowing them to be more independent, but also it's a benefit on the cost side. It will allow us to have less staff, like the example that Matt mentioned around, one of our people supported that, doesn't really need 24/7 staff, doesn't really want them in his home. And this technology can enable him to live how he wants to live, and also allows us to reinvest that money to support more people. So the last program initiative that we're working on right now is the Smart Lab that Matt mentioned. We are converting one of our homes on our Bronx campus to showcase different technology and solutions tailored for people that we support. And we're also planning on expanding that or extending that to other populations and just the community in general. There's seniors, veterans, folks with physical disabilities that could absolutely benefit from some of these different technologies to support them to live more independently, to age in place. And so I think we're obviously going to be initially tailoring it to our population, but I think we're going to be making it available for anybody and everybody. It's going to be set up as a home with a kitchen, a dining room, a living room, bedrooms, and bathrooms with different technologies and solutions that promote independence, community integration, and quality of life enhancements. And the different technologies will be, specific to each of the rooms. Like in the bathroom, there's going to be technologies to support people to bathe on their own, to brush their teeth on their own. In the bedrooms, there's going to be technology to support people to get dressed on their own, to do their work, sitting on a desk and do work, or, engage in, entertainment or things that they like to do for fun. In the kitchen, you need technologies to support people to cook on their own, to prepare food. The dining room, technologies to help people eat on their own, to support them, if, different ways to eat more independently. So we're trying to have a variety of different tech available in the home to show people, this is a sampling. There's probably more stuff that's out there, but this is stuff that we know that works and we know that people can benefit from. And you come here, you can, not just the people that we support, but their families, their caregivers, anybody really can learn about, test out, and train on different technologies. We're also planning on offering guided tours and allow people to explore and test out the devices on their own. So it's going to be kind of like a little bit of a museum type of environment where, you can get a guided tour, you can walk around and kind of browse. And then we're also planning on offering assessments to match people with technologies and solutions that address their needs and meet their goals. Including for home enabling support. So for folks that are eligible for that program, they can have a place to go to actually see those technology in person, feel them, touch them, see if it works for them, so that they don't end up getting something that doesn't ultimately end up working for them in their home environment. And like I said, we see this as a stepping stone towards integrating technology more broadly, including in our residential programs. One of the interesting things is, it's opening up the door for us to partner with some of these technology companies in different ways. I think on the next slide, you'll see, this is just a sampling of some of the different technology companies that we've been speaking to about this new, about the Smart Lab, about home enabling supports, and about other initiatives that we have going on. And they're very interested in working with us to making their technology available. And so we're trying to figure out ways to generate new revenue streams related to this. And so we're kind of scratching the surface. We have a little bit more to go and we have more conversations to be had. But I think there's a lot of promise here and there's a lot of interest on the side of both the technology companies, people that we support, family members, our staff, and I think we're trying to build all that great excitement from all sides, from all stakeholders, to kind of keep things moving and keeping the excitement from preventing, folks from getting scared that technology is, a bad thing. It's going to change, my day to day or anything like that. I think we're trying to share this in a positive light. So Matt, I'm going to turn this back over to you.
Thanks, Ron.
So
yeah, I'll kind of go. I know we have only a few minutes left, so for the sake of time, I'll kind of go through these next couple of slides very quickly and then open it up for questions. For me, in terms of next steps, and one of the lessons that we learned, and I've learned it the hard way a few times, is we didn't always, and it's number 2 on the slide, is we didn't always research the different options, either comparing the costs, or compatibility of different products. I think a lot of times when tech came, you know, when you see tech and how you could use technology, you start to think, oh, wow, I could use it for this and I could use it for that. And not really have a real plan on how to use it and how it could impact the person. And, you know, it's a lesson with good intentions, but it's a lesson we've kind of gone through and still are going through, right? Still a lesson that we learn, that I'm learning. But absolutely making sure that the tech is compatible both for the person and their needs, that they could use it, that they want it, that they like it, and that could really impact them. We've done similar projects, like I talked about the person that it benefited. We installed similar technology for someone else and it kind of just collected dust. And that was a, you know, a lesson you learn the hard way. So assessing the person's needs and ensuring that the technology is compatible both for the person and if the tech is compatible with each other is so important. We go to the next slide, Bill. In terms of how to get involved and how our involvement began, obviously strategizing, looking at where there are gaps, where there's a need, and where a person has a desire. And I think keeping that at the focus and keeping it at the center and realizing what you want the outcome to be and what the person wants the outcome to be, and then using technology to bridge that gap. If the person wants to live by themselves, but needs some sort of level of support, what technology can be used to support them, like we talked about before. If the person doesn't want to live by themselves or needs a person in there, a staff person in their apartment at all times, but just wants the simplicity of being able to turn their lights on and off, but physically wouldn't be able to get to from their bed, and they're not able to get out of bed, like Deval, the founder of Lotus. That's kind of what triggered him to start it. If that's all they want, then what product could be used for that? And I love the Lotus ring, because it is so simple and so easy to use, but so impactful and has a you know, a real impact. And when you talk to the people supported, we did something similar with a person that was in part of the trial, and all she could talk about was it's made her life easier. Was she able, or have a staff person able to turn her lights on and off before? Absolutely. So that wasn't in the dark, but the ability for her to be able to control and access her environment using something as simple as a ring. And what was cool about Lotus was you're able to bring it anywhere. It's technology that you can sort of bring anywhere. So if you're in your living room, your bedroom, your kitchen, it's wearable, so you could use it wherever. And those are just some examples. And then, you know, obviously thinking of different ways to fund this, because some of it's expensive, exploring grant opportunities, different donations, or partnering with these organizations that want you to beta test their product, or in the case of Lotus, give you 20 products or 20 people their product as a thank you for using their product, right? It's just a matter of asking them. And that's kind of what we found is they're hungry, especially the companies. They're hungry for a partnership. And for us, if it could benefit the people we support, we're equally hungry. So that was the sort of a dual benefit. Let me go to the next slide, Mo. And this will kind of be sort of how I end or how we end, and then we can open it up for questions. But obviously the most important, I've kind of said it a few times, measuring the impact on the quality of life and measuring how it benefits the organization. If we could show, and you know, I think we're starting to demonstrate through stories, through anecdotal examples, but through data, how it's truly impacted a person and how it's truly impacted ADAPT as an organization. You start to get buy-in both from the local, state, and you know, hopefully federal levels in terms of funding and regulation. But in order to do that, you need to truly measure the impact and success of what you're doing. And that's something that we've struggled with for a long time. I think we're starting to do a much better job at both the success and the failure. What's worked, but also what hasn't worked. With the example I talked about before, where the technology kind of just sat there. Well, why did it just sit there? We didn't have a plan going in, and we thought that just installing Alexa for someone that didn't want to use it or needed more support using it or whatever, we thought it would work. Good intentions, but it didn't impact the person. And we'd have to find another way to use technology for a person like that. So data on both ends is so important. And obviously involving the people that we support and their caregivers and their input, and especially our direct support staff or our frontline staff. Some of the best input that we've gotten outside of the actual person has been the frontline staff, because they're able to tell us what the gaps are and how we can help use technology to bridge those gaps. So, that's sort of it for the formal part. I think we've left a couple of minutes. I know we said 10 minutes, so we're kind of a few minutes behind, but, a couple of minutes for questions if anybody has.
Thank you both for the wonderful presentation. If anybody has any questions, you can type it in the chat